Have you ever wondered what a hip replacement is, how it's performed, and what we actually put inside your body? In today's video, I'm going to answer all of those questions, so stay tuned. Hello, I'm Adam Rosen, and today I'm going to talk to you about hip replacements. We're going to go over what the three most common reasons are for needing a hip replacement, and then I'm going to walk you through the actual operation and show you some of the parts that we use to replace your hip. So the most common reason for people in this day and age to get or need a hip replacement would be hip arthritis, where you've lost the cartilage on the ball and or socket, and now you have pain. The second reason that you might need a hip replacement is something called osteonecrosis or avascular necrosis, which is where the blood supply to the ball is compromised and the ball collapses. The third reason that you might need a hip replacement is a hip fracture. So if you fall and break your hip, certain hip fractures are treated best with hip replacement, while other fractures are going to be treated with plates and screws or rods. So a hip replacement, what is it? We're actually replacing the ball and the socket portion of your diseased hip joint. So if we look at this sawbones, this is the actual thigh bone, and attached to the top is the femoral head. So when this portion loses its cartilage, it develops arthritis. Or if you've fallen and you've broken through this region called the femoral neck, you may need a hip replacement. And what we do is we go in and we actually take a saw and we make a freshening cut and we remove the diseased ball, or we freshen up the portion of the bone that you've broken. The next part then is using a stem, and there's all different types of stems, but they get placed inside the inside of the bone where the medullary canal is. This is the tube inside the outer portion of the bone called the cortex. So if you think of a roll of paper towels, the cardboard is the outer cortex, and the hollow portion inside is where these stems go. We start with the smallest size, and it gets placed inside the bone to prepare it or mill it for these stems, and we keep growing up to a larger and larger size until you find one that fits your bony anatomy the best. At that point, we have balls that are made of either ceramic, like this one, or metal, that then get placed on top of the stem, and this essentially reproduces the thigh bone portion, the ball portion of your hip joint. The other half of the operation is to replace the diseased socket. This is called the acetabulum. So this is half of the pelvis, and this is the cup portion of the acetabulum. When you lose cartilage here and you develop bone spurs around the rim, it will cause pain and it will limit your motion. So what we do is we go in and remove the bone spurs, and then we actually use a device. It's called a grater. Some people call it a reamer, and it's because it actually looks very similar to a cheese grater, where it has these much smaller than this, but little edges, and they are little half circles that we place in there, and 1 millimeter at a time expand until we make the misshapen cup perfectly round again. And then there's a two-part shell that goes inside. So I always like to have my patients think of it like half of a tennis ball. There's an outer half, which is roughened, that the bone will grow into. So this gets put inside that socket. But then on the inside, we have a smooth plastic liner that serves as your cartilage. So this is an actual cup, and this metal cup you might be able to see is roughened, and that then goes inside the cup portion of your acetabulum, and then inside that goes a plastic liner, and that gets snapped in there. So now, when you stand up, you have the stem inside the thigh bone with the ceramic ball on top, the metal cup inside the pelvis, and this plastic liner inside the metal cup. And this essentially makes up your new hip socket and allows you to bend and straighten and walk and do your exercises. So I hope in this very brief explanation, it helps you understand exactly what some of the reasons are that you might need a hip replacement, and then at least goes into some detail of what the operation is and what parts are put into your body that allow us to reproduce your hip. So thanks for watching. If you enjoy this video, please subscribe so you'll be alerted when new videos come out, and be sure to click the like button so people like you that are looking for information like this can find these videos. Until next time, stay safe.